Nearly one-third of Americans breathe in polluted air every day, and a new study from Johns Hopkins University has found a better way to measure the health impacts we face from breathing in this toxic air. The result? The study found that regulators are likely greatly underestimating non-cancerous health risks that we face, likely to harm our brains, lungs, and hearts. While this may sound just like bad news, researchers believe that this discovery could be a game changer for polluted communities across the nation. This is especially important right now as the Trump administration is proposing to roll back clean air protections. Atmospheric scientist and study co-author Pete DeCarlo said that the standard method for measuring these types of air pollutants and their impacts looks at a specific chemical, determines which part of the body is most likely to be harmed at the lowest dose, and identifies that as the point of harm. By doing this, they assume that no other parts of the body will be affected.
That doesn't work when you start to think about multiple impacts and cumulative burdens, because then you've ignored the other health impacts that are also important and are impacted by that same chemical.
In short, this method can miss important health impacts from pollutants, especially when there are multiple chemicals acting in the air at once, according to Johns Hopkins University Environmental Health Sciences and Engineering professor Keith Nachman.
Our method does a better job than existing traditional regulatory methods because we account for all the different ways each of the chemical acts on different parts of the body and then take them all together and forecast for people living on the fence line how likely they are to become sick in a number of different ways.
Professor Nachman and a team of researchers considered all possible health impacts of 32 chemicals that they observed when analyzing air samples throughout southeastern Pennsylvania, which is home to polluting industrial facilities, power plants, and traffic pollution. Traditional research methods would have found no significantly increased levels of health risk for this community, but this method found 5 distinct problem areas, including impacts to the nervous, hormone, and respiratory systems. Accurately estimating these types of health impacts is especially important for communities that live close to these pollution sources. These areas, commonly called fence line communities, are often home to low-income communities and communities of color.
The cumulative impact of all of these chemicals on the human body is not only devastating, it is the type of thing that is generationally crushing.
Heather McTier-Toney, executive director of the environmental advocacy group Beyond Petrochemicals, says that this report serves as evidence for issues communities impacted by the petrochemical industry have been complaining about for decades. Specifically, she referred to those living along the Gulf Coast, through Texas and Louisiana, and Pennsylvania's Ohio River Valley.
This is data that should not just sit on someone's desk. It's data and information that should live in the places that we work, we play, we pray, that we're gathering together, because that's where the impact is felt.
Researchers DeCarlo and Nachman are hopeful that these studies can be replicated in other parts of the country and hopefully inspire regulatory changes in areas that are willing to listen.